Good evening, everyone. Today's topic is about construction of an operation theatre, and follow me at my YouTube channel, Painfree Partha, and also many slides are also available in my website www.painfreepartha.com. So, why do we need to know this? It's in the heart of any hospital construction. Any hospital, where is the operation theatre? And sometimes some may call where ICU, where labor ward. So it's the heart of any hospital construction. So it needs civil, electrical, mechanical, biomedical, electronic, and biopure. See here, now it needs civil. Now it needs electrical. Many of the construction finishes with here. But we also need some mechanical, some biomedical, some electronics, and some biopure. We not sterile zones and unsterile zones, clean zones, all these things are there. So hospital construction, there is something distinguishing between the construction of an operation theatre and other things. So it's a combo effort. Purpose of an operation theatre complex. What should be borne in mind? It is therapeutic, investigative, palliative procedures of varying degrees of invasiveness. It's therapeutic. Now you give hernia operation done. Investigative. Sometimes you do a CSF analysis. Sometimes you do palliative procedures behind the back, epidural, something like that. So this varying degrees of invasiveness. It may be a coronary artery bypass operation, or it may be a simple hemorrhoidectomy. Varying degrees of invasion. Where is the location? Where it should be? Now you have got it. Where should it be? An operation theatre. Should not be having an operation theatre in a big crowd access, not in the ground floor, preferably in the first floor. We should have access to post-operative wards through OT, canteen, other cross-through wards. All these things should not be there. Okay, now you have an OT. Some canteen is there. Some other wards, then the people will come and go there in between. But even though the gate is closed, people move here and there. So all these things should not be there. It should not be a pass-through like. Maximal benefit we should have with minimal space. This is what is the principle of construction of an operation theatre. Now we divide it into 4 zones: protective zones, clean zone, sterile zone, and disposal zone. What is protective? Protective means we are clean and it is not necessarily sterile. We have change rooms, we have pre-operative areas, we have transfer-based staff rooms, sometimes stores and records and post-operative care units. Now you see, this is a pre-op. You have to maintain privacy. We have to sometimes go from street clothes to gown, maybe providing lockers and laboratories to staff. You may need to take an IV line. You may need to take a urinary catheter sometimes, Sterile tube. We should have facility for oxygen, suction, all these things, even CPR. So this is what is pre-op. So then it becomes an induction room. When it goes to induction, means there are certain operation theatres where we have an induction room separately sometimes. We induce the case and then shift the case to decrease your time. So that should be sterile. It should be linked to OT complex fast, all gas outlets, emergency equipments, machine, theatre staff, everything should be clear. But most of the times, your operation theatre main complex is your induction room. Staff facilities: one wash basin, one western for 8 to 10 persons. Showers may be there. Toilet inclusion in changing room is a question. Yes, rockers are there, lockers. So for doctors, sometimes to staff nurses. So what this is about protective zone. Now we are going to clean zone. This is in between protective and sterile. This houses the sterile areas. Maybe lab, there may be a seminar room, something like that. It's relatively clean zone. Now we go to the sterile zone. Sterile zone means, now I want to slightly this thing. If you are going to the clean zone means you should be definitely in theatre dress. It should be developed in the OT dress only. The main operating area with the scrub zone, wash, and then go to the operation theatre. Then after the operation theatre, where does your soiled instruments go? That will go to the disposal zone, sorry. through a separate exit which goes to a disposal area. So sterile and unsterile items should not go in the same hall. Now we have this thing and we have that thing here. Should not go like that. Washing area is a different area from a scrubbing area. So to wash the hands is different from washing the instruments. Scrub means wash your hands, scrub and go. Washing area means you should not this thing. Elbow operated infrared sensors, operated tap water source is detailed. It is essential to have non-slippery flooring in this area. We should not have slippery flooring where the water comes. This is the elbow tap. We can have elbow press of betadine also here. This is what the entrance is. Sometimes the red carpet is there. If you go in and this is a clean zone and you go in, this is a protective zone, clean zone, and then we'll go into the sterile area. So this is yellow, green, and red. So these are two theaters. In between there may be sterile storage rooms. Sterile storage rooms. And where we have autoclaved ready instruments or gas sterile instruments ready for the theater work. All these things are touch. We need to have flush with the wall. 6.5 meters plus 6.53 meters. This is 21 feet, 21 feet into 10 feet. 5 feet sliding doors and no air currents. Surface should be slip resistance, flush and no big grooves. Epoxy paint walls. Flush outlets. Protruding trays from the walls should not be there. There should not be protruding trays, and we should keep bottles, catgut, and all these things should not be there. And preferably in a soothing blue paint. So 21 feet, 21 feet. It's nearly a square with around 10 feet height. 5 feet sliding doors, no air currents. Epoxy paint walls. You should not have big grooves in this. You can see grooves here. So these grooves are for bacteria and viruses. So we should not have grooves. All this to be flush. Smooth but non-slippery floors. Jointless conductive tiles. You should not have a lot of joints. Need for an anti-static flooring is diminished as flammable ether era is gone. So we are less concerned about your anti-stasis. You can see the anti-stasis boils machine, carbon, this thing and all is nowadays going down, down, down. Sometimes we need so much big. Here you can see 1, 2, 3, 4, 5, 6 tables are there for this operation. They are doing something in the leg and something in the hand. So we may need to have so much 21 by 21 by 10 feet. One OT, one table. That is a must. So we should not have one OT and put tables here and there and that's surgeries. We should have X-ray illumination. And electric should be above 5 feet above the floor. We should have pendants, preferably 2, and reserved for all. Corridors should be minimum 9 feet. Yes, we should have a big, wide stretcher going and turning comfortably into this hall or this room or this theater or anything. So preferably the minimum is 9 feet. Pendants, also this is a one pendant. It has got, there are bar pressures, nitrous oxide, oxygen, and some electric sockets, scavenging outlets, everything is there in one pendant. Sometimes we may need 2 pendants for the operation theater. So vacuum. So sometimes the bar, different medical compressed air will come, different bar, 4 or 7 bars, or sometimes the orthopedician they will do. For that we may need compressed air at higher bar. Electrical safety, we are not bothered now. How many OTs should be there? Now we have OT like this. How many OTs should be there? For example, now 750 bedded hospital, we have 375 surgical and 375 medical. Okay. Surgical means ENT, ophthal, orthos, general surgery, gynec, everything. So we have 375 as surgical cases and 375 as other cases. So approximately you divide by 10. That is 37.5, 38 surgeries per day for each 150, one OT complex. 2 OT complex with 10 each is ideal. If you have so many surgeries, you should have 2 OT complex and 10 and 10. And endoscopic septic operation theaters are different. Now you have a 500 bedded hospital, 250, 250, 250 by 10, approximately we will do around 25 surgeries per day. So we should man things like that. What's the general lighting? Should be 500 lux. On table, it should be center, it should be 50,000. Shadowless and cold. These are the two things of an operation theater light. If the light is blowing like this, even if you keep a hand, the field should not have the shadow of the hand. Cold light source, very important. See, many of the things you'll see CLS, cold light source. Even if in endoscopy or laparoscopy, one fiber optic, one cable will go and connect to the laparoscope, and they'll see the light is there. And from there, it will go to a dabba, some small box where there is a fan. So the fan will take away the heat produced by this, and you will have a cold light source. UPS adequate for OT lights, anesthesia machine, and monitors. Now, air handling unit in the OT, including air quality. Air is supplied by the terminal filters in the ceiling, or sometimes it is in the side. Male filters, side takers. The minimum size of the filtration area should extend 1 feet on each side of the operation table to cover the entire OT table. Now the OT table is like this. Now your OT table is like this. Ceiling, 1 foot here, 1 foot here, 1 foot here, and 1 foot here. This big area should be the HEPA filter above the ceiling, which forces air from here and go down. This is how we should construct the HEPA filter just above the ceiling. Now you can see laminar air plenum, 20 air changes may be there, around 20 degrees C, approximately 60% humidity and positive pressure inside. So if you have a negative pressure inside the theater, if you open the door, air from outside will go in. So there should be a positive pressure inside the theater. As soon as you open the door, air will go out of the theater. There is less chance of infection. There is less chance of bad air coming in. So approximately 60% humidity, 20 degrees C is there. So it is an air handling unit. So this is how this from the HEPA system it flows here, and this is what determines the laminar flow. These two things or sometimes four on the corner of it, they suck in such a way all these things. The ducts are so much or calculatedly placed like that. So it creates a laminar flow. The HEPA filter, above that, the AHU air handling unit that gives the temperature, that gives the AC, that is AC and humidity. That gives the force here above the ceiling. And above that it goes like this. Only the ductal system of your sucker creates a laminar flow. Now you see this is the laminar flow. Laminar flow systems. What is the traffic route? The patient should come in here and it should operation theater here and exit here. And the scrub staff should come here, scrub and go in and can go in. The dirty should go out like this. This is what is the basic traffic route of an operation theater. The dirty should not go in like this and go out like this. The disposed material should not go in like this. So it should come like this. So why do we need AC? Cool temperature, less growth of bacteria and viruses, less sweat of staff. They are active always, even for 6 hours surgery. It decreases the heat effects of 40 lights. There is less condensation. All these things make an air conditioner at around 20 degrees C a must. So HVAC, heating, ventilation and AC. What is about AHU? Air handling unit takes 10% air from outside. 90% circulates the same. It controls the humidity. It controls the temperature. Now, our temperature is 28, so it cools. If you have a place where the temperature is 8, how it can come down to 20? Now, there is a heating coil there. Now, that is what is the difference between air conditioner and air handling unit. It is also got a heat coil. You can see in the car AC, tuck switch, sometimes the heat air will come down and your condensation will go off. So that is what is needed in a air handling unit of an AC or an operation theater where it is situated at temperatures below 10 or something like that. So IoT, cardiac OT, neuro OT or special. Here you can see cath lab. There is a red light. There is pregnant people should not enter. There are a variety of differences between all these OTs. Laminar flow comprises a continuous flow of highly ultra clean of less than 10 colony forming units, uniform velocity, single direction, parallel flow. There are 300 flow changes and particles are also less. Now we have AHU has three chambers. First chamber has provision of fresh air inlet and returns air inlet. The second has got 5 micron filter into the second chamber. It is cooled by condenser coils and blown by an air blower, and also a set of 3 micron filters into the chamber. The cool filtered air now goes through the aluminum air ducts into the terminal plenum inside the OR, which has also got this 15.3 micron HEPA filters. Okay, this is how they HU. First, it passes through 5 microns because outside length it gets the air. It should be filtered. Then it goes and condenses coils and gets into 3 microns and then goes into the HEPA filter at 0.3 microns. So this is the AHU, and this is air take from outside, first filter, second filter, HEPA filter. This is what I have told. AC is from the air handling unit and HEPA filter is different. That's only the filter. HEPA filter is only the filter. So this is around this here. This is the air handling unit, which is in between these two theaters, the blue box here. No, this is the AHU of that operation theater here. Post anesthesia care unit, recovery room adjacent, medication station, hand washing station, stretchers, monitors, equipment, gas, suction outlets, and ventilators. 80 square feet for each patient. 5 feet between beds, 4 feet between wall. Now you see, one patient needs 80 square feet, 10 by 8. 5 feet between beds, 1 bed, 2 bed, 3 beds. 4 feet between the wall. This is an ideal post anesthesia care unit. You can see this is a bed, this is 5 feet inside, and the wall is here, and this is 4 feet. That is how a PACU has to have monitors, oxygen, suction, everything along with a good way to change stretchers for emergency care and all. So miscellaneous, firearms, equipments, phones, code blues, intercom areas, reception areas, data management and computer operators, catering and OT equipments. Sometimes just before the preoperative room, we will have a room with a lot of cupboards where we'll have endotracheal tubes, laryngeal mask airways, laryngoscopes, and fiber optic laryngoscopes, all these things, sometimes ultrasound machine in a separate room. So basically divide engineering based and ergonomics based. So engineering based is something which needs a structural integrity, but ergonomics based is important because if you construct a theater without the corridor where we cannot push the structure into the theater hall from the corridor, then it is waste. So it should be ergonomics based, where the anesthetist will stand, where will the anesthesia machine come, if it is going to be an orthopedic theater, where the C-arm will come. All these things should be ergonomics based, and it's also engineering based, and lastly it's finance based also. So blending all for safety, comfort, and manpower. Aesthetics is important. So think about many things are there, but disposal area coming again and plan for the dish, but it is not executed. So the disposal area goes in, and from there it is not completely outside. It slightly touches the incoming area and goes. So that is a thing. So otherwise, disposal area, unsterile things has to go to a separate place.